Hi, I'm Dr. Sreelekshmi, consultant psychiatrist, SUT Hospital, Pattom Hospital. As we all know, our International Men's Health Day falls on November 19, and we consider this month, November itself, as a month for considering all these healthcare aspects of our men. So I'm dealing with this mental health aspect. So mental health, as we all know, it's a state of well-being in which an individual realizes his or her own abilities and can cope with the normal stresses of life and can work productively as well as fruitfully and is able to contribute his or her own contribution to our society as well as our world. So this is what we consider as mental health. As we all know, the awareness regarding our mental health condition, their timely intervention and timely follow-up is alarming day by day. And the studies have shown that there are certain prevalence rates in women than in men, considering certain mental health conditions like anxiety, depression, phobias. But we also know that these mental health conditions are not immune to our men. Certain mental health condition, as we already suggested, in ADHD, it's common in male child, which can continue into an adult onset attention deficit hyperactivity disorder, certain mood disorders like bipolar disorders, depressive disorders, phobias, and completed suicidal risk. These are some of the mental health condition which is seen more commonly in men than in women. Certain psychoactive substance usages are also seen more common in our men. But in most cases, our men are reluctant to get a psychiatric help or a mental health help. Why? Why? Because most of our stereotypic societal expectations, like men should be strong, men should be independent, and he can't be vulnerable, he can't cry. All these set of stereotypical expectation makes most of our men afraid or hide their or mask their emotions, or they may feel fear to talk about their problems, their emotions, and most of the time they may be reluctant to get or reach out to any help. So these kind of unwanted expectations or these kind of societal harness, we should break all these things. There can be daily life stressors. There can be family stressors, real life personal stressors, interpersonal stressors, job stressors, relationship stressors. All these can happen in everyone's life. But at some point, these stresses can hamper our daily life sleep pattern. There may be a thing known as, there can be a thing that the sleep pattern interruption or a disturbed sleep pattern can be a major thing behind most of our major mental health conditions. This interrupted sleep pattern or sleep impairment can lead on to most of the major mental health conditions like anxiety, depressions, phobias, etc., etc. And in some youngsters, our men most probably, they will try to cope up by their own mechanisms. Unfortunately, these kind of stressors, they are dealing with some kind of bad coping mechanism, I already said, like of substances. Most often they rely on alcohol, tobacco, like nicotine, cannabis, and other psychoactive substances, which in turn can lead on to more trouble. Psychoactive substance related mental health disorders or mental health conditions can occur as a part of the recurrent usages, which in turn can cause impairment in their daily life functioning. For students, it can be difficulty in their studying. For adults, there can be difficulties in interpersonal areas of functioning or their occupational areas. There can be difficulties. So we person, we citizens, we need to identify or recognize the early symptoms and signs of the main major mental health conditions, including depressive disorders as well as anxiety disorders. All sadness, or there is a difference between a depressive disorder and normal sadness. Everyone can be sad, but everyone cannot be depressed. So in order to get a diagnosis of depressive disorder, there should be certain criteria. So some warning signs or some early symptoms we need to recognize. If at all your colleagues or any relatives or friends is having these kind of symptoms, we have to identify as early as possible. So in depressive disorder, most commonly, the main triad will be one of the low mood. Another one is easy fatigability. And the third one is anhedonia. That is a decreased in a pleasure or interest in previously pleasurable activities. So depressed mood that can be during most of the time of a day, and the patient may feel easily fatigued and have low energy, low self-esteem. Even if they are trying to do something, they can't initiate a activity. Even if they start to do a thing, they can be feel easily drained. They may lose focus. They may have a decreased attention. Some persons may complain of sleep impairment, that is insomnia. That can be initial insomnia. That is a thing that the person may feel difficulty to initiate the onset of sleep. Some may feel difficulty in maintaining the sleep. They seem restless. Most of the time, they may get sleep around 2 or 3 or o'clock at the night time. So, in other hand, some patients may feel excessive sleepiness. During the daytime, they may feel hyper somnolence, increased sleepiness during the daytime also. There can be excessive worries, that feeling of worthlessness, excessive guilt, and some patients even communicate recurrent thoughts of death. So these can be the symptoms of a depressive disorder. If at all, as I already said, if at all your colleagues or friends or anyone communicating these kind of symptoms, try to hear them, try to listen to them, try to give a proper support and care for them. Another major mental health condition is anxiety disorder. There can be excessive worries or excessive fear regarding any kind of activities in a day-to-day life. There can be the patient may feel increased restlessness, or they may feel zoned out, difficulty in focusing or concentrating any of the things in their life. And another dimension in anxiety disorder, which we commonly encounter nowadays, is panic attacks. We are hearing this panic, the name, more commonly. So, what is these panic attacks? Panic attacks can be it's an intense surge of fear. It's an intense surge of discomfort that the patient may feel. There can be physical symptoms as well as the psychological symptoms, that the patient may feel an increased heart rate, in a pounding heart. There can be a sensation of shortness of breath, a feeling of choking, nausea. Some patient may feel chest discomfort. Some patient may feel chest discomfort, abdominal discomfort. Along with all these physical symptoms, the patient may have an abrupt fear that something is happening to me, something negative is happening to me. I can't control, or I am going crazy. These kind of psychological symptoms can also incorporate along with this kind of physical symptoms. So one can imagine the power of panic attack or the strength of panic attacks. And if every third person may not understand the feeling that one person is having when kind of in a stage of panic attack. So these kind of panic attack, if it is happening recurrently, then we can label it as a kind of panic disorder. If the patient is suffering from the panic attacks, can interrupt their daily life functioning, their any kind of functioning can be hampered. So along with this depressive disorder, these anxiety disorder warning signs and symptoms here are these, and you should be aware enough to identify or recognize the earlier warning symptoms. Likewise, In many kind, this patient may reluctant to get a proper physical or healthcare delivery system is one among the major factors, stigma. Stigma related to this psychiatric treatment. There can be social stigma that most of our patients are facing. That's a negative attitude among the society towards our patient, towards our psychiatric patients or a group of patients, which in turn lead on to discrimination, avoidance, and ignorance, and all these things. And another one is self stigma. That's also another dangerous one. The patient himself or herself may internalize these kind of stigmas and may feel the shame inside that I'm not good enough to do a job, I'm not good enough to perform. And this kind of self stigmas are also a major dangerous thing, which serves as a barrier to reach out a proper mental health delivery system, mental health care delivery system. So, in this context, we need to identify, we need to recognize these things are the major barriers for our proper treatment, proper follow up, and the well being of our patients. So, everyone needs to understand that this mental disorders, there is nothing to be ashamed of. This is one kind of biologically, it's an organ disorder like any other diseases. Like if we are facing myocardial infarction in heart, we rush to cardiologist. If we are facing CKD, chronic kidney diseases, or any kind of acute kidney injury, we rush to nephrologist. Likewise, this is also a health condition we need to be taken care of. So, like I already said, there is nothing to be ashamed of to reach out for a special care. Likewise for a therapy sessions, for a psychiatric treatment, for a medication, if at all we are considering medication, do not calculate for the risk benefit ratio. If the medicine serves you a purpose, then it will be a help. So do not jump into conclusions that this may not be good for me, this will hamper, this may cause more danger to me. No, like that ideas can be dangerous. So try to identify the major health issues, especially in the mental health field. Then try to communicate with them. For those who are in distress, try to communicate with them, encourage them to talk, feel empathetic towards them, and validate their feelings. Do not normalize or do not simplify their problems like, oh, it's nothing, it can be, it's a problem for everyone, why are you making such a fuss? No, these are not at all the comments to be entertained for a person who is in distress. So always validate their symptoms, take time to understand their feelings, and give a proper support and care. Take a good sleep during your nighttime. Your nighttime sleep is a must thing for your proper functioning. For your proper functioning, take a good night's sleep, about 6 to 7 hours minimum, and do a good physical exercise. In physical exercise, consistency is also a key. Some patients may do physical exercise once in a while. No, this is not also gonna work. So, consistency is also a key in our treatment sessions in physical exercise. Do a minimum of 20 minutes walk, 20 minutes run, and have a healthy, balanced diet. For all our neurotransmitters, they are basically proteins. Their building units is again amino acids. So we need to include protein in our diet. So better we focus on preventing the mental illness. If at all they are getting any, there is nothing to be ashamed of in any case. We have to take them for a proper care, for a proper treatment and get them a good or better life. Thank you.